Every surgical procedure, no matter how simple or how complex, carries certain risks, and breast augmentation is no exception. There are several common risks that you need to be aware of. One is the risk of implant failure or implant leakage, and that does happen. The good news is the implants come with a lifetime warranty from the manufacturer. If the implant ever leaks, the manufacturer will give you an implant at no charge, so you'll never have to buy a new implant. There's also the risk of developing something called capsular contracture. Capsular contracture is the formation of scar tissue around the implant that you can tell is there. In the majority of cases, that layer of scar tissue is so thin and so flexible you're really not aware of it. In about 8% of cases, that layer of scar tissue can thicken up a little bit and put a little pressure on the implant. If that's the case, it can make the implant feel firm and sometimes makes it feel hard. Now, this condition is treatable, but it's another surgical procedure and does only happen in less than 8% of cases. There's a possibility of injury to the nerve that gives sensation to the nipple. The nerve that gives sensation to the nipple comes out from between the ribs and travels through the breast towards the nipple itself. In the process of putting the implant in, it's possible to injure the nerve. If the nerve is injured, or worse yet cut, you could have temporary or permanent loss of nipple sensation. The good news is that too is a very uncommon complication occurring in less than 10% of cases. Finally, there's the risk of infection. If you were to get a postoperative infection and develop pus around the implant, you would need to be on antibiotics and possibly have the implant removed. Here, we do the operation in a surgical facility with real doctors, real nurses, real anesthesiologists. We give you antibiotics at the time of surgery. We treat this like a real operation to minimize the risk and minimize any chance of infection.